Today, on a special edition of Full Court Press, beautiful Appalachia, majestic mountains, lush trees, but below the surface, the opioid epidemic raging. West Virginia Senator Shelley Moore Capito takes us to an organization using a new approach to help those suffering from addiction.
Not one solution is going to fit for everybody, so you have to have a whole variety, and you really have to have a fabric of all kinds of options, which is what they have here at Hazel's House of Hope.
Plus, we speak to a grieving father nearly 1 year after he lost his daughter to opioids. Hear how his tragedy is inspiring him to make a difference for others.
I can't change what happened in the past, but we can help others and help other families not go through this.
And from rock bottom to a decade of sobriety, we meet a man working to help others battling addiction get access to the same help he received.
The options for treatment in West Virginia weren't really there, and my mission became, let's replicate what's out there.
Full Court Press starts right now. Hello and welcome to a special edition of Full Court Press. I'm Greta Van Susteren. A crisis on top of a pandemic. For more than a year, the nation battling COVID-19. More than 30 million Americans infected, hospitals overflowing, the healthcare system overwhelmed. But all the while, the opioid epidemic exploding. The latest numbers showing between November 2019 and November 2020, drug overdose deaths increased nationwide nearly 30%. And experts say COVID threw gas on an already blazing fire. Fear of contracting the virus kept some drug users from seeking help. Treatment centers closed or limited intakes, and lockdowns left people isolated, stripped of their support systems. West Virginia has more deadly opioid overdoses per capita than any other state. Senator Shelley Moore Capito took us there to discuss the scourge slamming Appalachia.
Sadly, we have been the epicenter of the opioid crisis. Our statistics, our deaths by overdoses per capita are the highest in the nation. And, you know, it is centered in Appalachia at some points, but it also then has, like some of my friends from New Hampshire, they have very high statistics too. So let's look at why we think this problem has developed in West Virginia. Some of it, I think, has developed because downturn in certain industries, people become jobless, depression, hopelessness, or you might have workplace injuries and you're prescribed painkillers, and then an addiction grows from that. So I think it's a whole variety of reasons, and we've found, I think, here in West Virginia that the best solutions are community solutions that are from the ground up, where the community, like the Morgantown community has, is sort of tries to figure out how do we crack this problem from all different ways to try to stop those statistics. They went down during pandemic, but then they went right back up and even higher.
The pandemic pushing West Virginia to the brink. State health officials forced to deal with two crises at once. In 2020, West Virginia's Department of Health and Human Resources counted at least 1,099 opioid overdose deaths, the number up from at least 671 from the year before. All this happening during a once-in-a-century pandemic. Senator Capito says this is not just a West Virginia problem.
And what do you think that is? Because people were home and there's despair, not knowing what was going to happen with jobs because of the pandemic?
That was a nationwide phenomenon. I think what happened initially, people who were in treatment were only getting access to telehealth. And it looked like, well, this is going to be, we're going to be able to sustain this treatment model. But I think just anecdotally, I don't have the statistics to back this up, but I think what happened was losing that face-to-face interpersonal treatment model and recovery model really caused people to relapse back into despair, back into more addiction. I think also the loss of jobs, definitely, and then not an ability to move into a job after you've completed your recovery. So all these things started working against, I think, a lot of folks who were in fragile states anyway, and I think people relapsed into addiction, unfortunately.
Hazel's House of Hope in Morgantown, West Virginia, is taking a unique approach to fighting addiction. The 10-acre property will be transformed into a community shelter and treatment facility. The center houses several nonprofits under one roof including the Bartlett House, the Salvation Army, and United Way. The center also tackles food insecurity and homelessness, which can often be the result of addiction.
This is obviously a place where we're helping people. You're in Washington trying to get bills passed. What do you need? Do you have everything you need? I mean, what's on your wish list?
Well, I think what we need is flexibility for the locals, to be local facilities to be able to contextualize the treatment for the area. For instance, this model may not work for a large urban area.
It's being tried. I mean, at least something's being tried.
Right.
I mean, that's important.
Right. And I think what's been decided in this case is that having a whole comprehensive under one roof ability to work together, coordinate, and then be able to actually solve the problems in the same area, I mean, I'm talking about the same physical area, it is a model that could be very, very effective.
Hazel's House of Hope is set to open at the end of August. It will be a no-ask operation. That means people working on recovery won't need to produce an ID, payment, or referral, and no one will be forced to attend or stay. Hazel's House says those who truly want to heal come of their own accord. Coming up, a parent's worst nightmare, driving one father to prevent future heartbreaks.
She often talked openly about, addiction, and she said, Dad, there's so many people that need help that can't afford it. So we're going to finish what she started.
Welcome back to a special edition of Full Court Press. President Biden putting harm reduction efforts on his list of drug policy priorities. The idea? To help drug users survive and stay safe before they are ready to seek treatment. That means funding centers that provide sterile needles, naloxone to reverse overdoses, and test strips to determine if drugs have been laced with fentanyl. This year, for the first time ever, Congress allocating federal funds to boost harm reduction efforts. It's a controversial issue. Critics argue these programs enable drug users, but those who support them say they prevent the spread of disease. Regardless of what your position is on the debate, there is no question overdoses are up. Since 1999, more than 900,000 Americans have died from drug overdoses, and opioid overdose deaths have multiplied more than 6 times. Senator Capito says the family of anyone struggling with addiction will tell you one of the things they fear most is getting that call, informing them their loved one is gone.
I think that if you talk to, and I think you're going to talk to parents who've lived this life, it's like every night you put your head on the pillow, you just don't know if the phone rings or if something happens in the middle of the night. You just know that call's going to come at some point, and fear it. And I've even heard anecdotally folks who say, I was so glad my daughter was in jail because she couldn't get it there. I mean, who would ever wish their own child to be incarcerated? But that was a bit of a safety for that parent to be able to sleep better that night, knowing that they're and that's what happens too a lot. Not only do you have the health consequences, you have the legal consequences. A lot of these, and this is what happens when you're trying to transition people out of treatment. They have a felony or they have some kind of a long list of misdemeanors and a bunch of mistrust from family members and everything. For them to transition into a job, to be able to stand themselves back up is really difficult.
Some families pay the ultimate price. Lauren Cole graduated with a 3.5 GPA, played intramural sports, and had a promising future that started to slip away when she became captive to her addiction. And in July 2020, her father witnessed a sight no parent should see.
And then when I pulled him beside it, she was slumped over in the driver's seat. So I immediately called 911, jumped out of the truck, went over and got her, and whenever I picked her up, she had already passed.
That's horrible.
Now Michael Cole finding purpose in his tragedy, creating a beacon of hope for others. He founded an organization to help people beat this all-consuming disease.
Lauren's wish is, it's an opportunity, as this whole thing has developed and the passing of Lauren, I've learned an awful lot. Obviously what we're currently doing isn't working. We're essentially losing a generation. And if we're not careful, we will lose a generation. Lauren's wish came about whenever Lauren was in the emergency room. You know, they do what they can. But once you have somebody suffering from addiction leave that facility or leave that ER, they're right back out into the environment to put them there to begin with. And you lose that opportunity to bring them in and offer them additional help. And as you know, our team calls it the warm handoff. So what we want to do is we want them to come into the ER, if walk in, be transported in, however it may happen. We're going to ensure that they're medically stable. We're going to surround them with a caring doctors and nurses and social workers that are trained in addiction and know how to interact with people suffering from addiction, and hopefully get them to realize that there's a different option, an opportunity to battle or get through this battle. Here at the Hazel's House of Hope, we've rented out a wing to where we're going to have that type of staff here to work with them, get them through their detox, and then work with them to get them into a long-term care facility.
Well, I think a lot of people are going to benefit from this. I'm just sorry that that you had to go through this pain and lose your daughter to help others like this.
I can't change what happened in the past as much as I'd love to, but we can help others and help other families not go through this.
Thank you to Mr. Cole. He says, as tough as it is pushing forward with this mission, it is what his daughter Lauren would have wanted. Up next, thousands of lawsuits taking on the deadly opioid supply chain.
I think it's a systemic failure all the way through.
Senator Capito and I discussed that after the break. This special edition of Full Court Press. Across the country, thousands of opioid lawsuits. In New York, a landmark trial now underway. And for the first time, opioid manufacturers and distributors facing a jury for their role in the national opioid epidemic. And in West Virginia, a federal judge considering another lawsuit. Cabo County and the city of Huntington suing the nation's largest drug distributors, and city and county officials are blaming them for flooding communities with millions of opioids. Officials argue when the supply dried up, people turned to heroin, fentanyl, and methamphetamine to feed their addictions. The distributors argue they sold legal pharmaceuticals according to federal regulations and pill quotas. They blame doctors, the Drug Enforcement Administration, and other regulators for the rampant opioid abuse. A Harvard health economist called as a witness in the trial estimates prescription opioids caused about $3 billion in damages in just Cabo County and Huntington alone. I asked Senator Capito about the opioid pipeline in West Virginia.
I read just an incredible statistic where something like 3 drugstores or pharmacies in the state got, in a small town of about 3,200 or 3,400, had something like 13 million pills, opioid pills, land in the pharmacies. I mean, which is grossly out of sync with what you would expect a small town to get. How does that happen?
Well, that's the town of Kermit in southern West Virginia, Williamson, several, more than a few, pharmacies, physicians, and others sort of colluded to really ramp up the prescription numbers. And there's a big court case going on right now in Charleston, West Virginia, for the distributors to see if why were the safety protocols of the distributors not in place to see the enormous, I mean, millions of pills going into these areas. And so those areas then became sort of drive-by drug outlets, and it was known in the region that that's where you could go.
Purdue Pharma for the last 15 years has been pouring money into Washington. A lot of senators on both sides of the aisle, Republican and Democrat, were getting money. Meanwhile, many parts of the country were getting poisoned by this. Not the ones who had legitimate injuries and needed pain handling,
right,
but the other ones.
Right. Well, if you read the stories of the origins, and there's lots of really good books out there that talk about how this progressed, particularly OxyContin progressed as a drug to treat pain, and what the marketing protocols. There's a big case in Cleveland that has been addressing this on a more national basis. And again, I think it's a civil case, but it's massive. Some of them have already settled. Some of the pharmacy companies have already settled. And I think that, we didn't recognize it until it became, I mean, I can tell you here in West Virginia, when I first became aware of the amounts of drugs that were being sold, it was more as a reflection of the amount of overdoses when you're talking to your first responders, how many responses they're making in a day, where they're going to the same house 3 and 4 times a day. One of the big things was in Huntington, West Virginia, where 26 people overdosed on the same exact day. Now, that was a fentanyl overdose, because what happened is once we tightened down through the state and the feds on the distribution of pain pills, then those addicted go to heroin, they go to methamphetamine, and then this whole phenomenon of fentanyl comes up, which is extremely toxic and dangerous, and has ended the life of too many West Virginians.
Coming up, a decade of sobriety after a living hell. One man's success story after the break. Welcome back to a special edition of Full Court Press. Last year in West Virginia, emergency workers responding to nearly 10,000 suspected overdoses. The ages of those abusing substances running the gamut. West Virginians between 30 and 39 years old, seemingly the most at risk, but no age group is unaffected. Drug addiction impacts the entire community. Senator Shelley Moore Capito took us to WVU Medicine, Center for Hope and Healing. The center helps adults struggling with addiction. There we met Doug Leach, founder and CEO of Ascension RS. He says his sobriety journey showed him that addiction does not discriminate.
In college, I had an injury, got prescribed pain medication. I used all of the pain medication. I kept calling back and requesting refills and saying the pain was really great. And it was something, once I took pain medication, it made me feel like a part of life again. You know, I had depression, anxiety, things like that were going on, and whenever I took pain medication, I felt better. And it just, there was a perfect storm of me working and living in Pittsburgh and having the money to buy drugs, the availability of these drugs, and it took me down in very, very short order.
Tell me, you said you're from a good family. Tell me what your family is like. How many brothers and sisters?
Yeah, I have one sister.
Older or younger?
She's older. She's a year older than me, 16 months. Mom and Dad spent a lot of time with me as a kid, encouraged me, helped me go to college. You know, it was for me, it was the stigma. Coming out and telling people that I had a problem was so hard to do. And the funny thing is, everybody knew. You know, it's the best kept secret that everybody knew. So my addiction culminated in an arrest in Morgantown. I went to, in a blackout, I ended up in the North Central Regional Jail.
For what? What were you arrested for?
I was arrested for a felony charge of malicious wounding and DUI with injury. Got behind the wheel of a car downtown Morgantown on the last night that I drank and did drugs. So I woke up in jail, getting read my charges, and that was, for me, it was rock bottom. I injured a person in this accident, and at that time I didn't care if I lived or died. I thought about suicide probably daily, but I never wanted to hurt another person. So coming to in jail, hearing felony charges and that I hurt somebody was unimaginable. I got the opportunity after being in jail for a little while to go to treatment. The folks at WVU Medicine were working closely with my parents to identify options for me. They sent a psychiatrist down to the jail to meet with me and do an assessment. And because there was not a residential treatment option in the region and very few options in the state, they sent me to an out-of-state facility. And I was very fortunate that my family could pay for me to go to treatment, or else I would have stayed in jail.
So you've been sober 10 years?
A little over, yep.
A little over. Congratulations.
Thank you.
You know, for every one of you, though, there are thousands and thousands who don't come out of this.
Yep.
What's the difference?
It's really hard to tell. What I do know is that I had a great opportunity to go to excellent treatment out of state. the options for treatment in West Virginia weren't really there. WVU Medicine had a very robust outpatient program and psychiatrists that had helped me through the years. But there were no sober living homes in the area, no residential treatment, and my mission became, let's replicate what's out there in Minnesota here in West Virginia, so others have the same opportunities that I did.
Thank you to Mr. Leach. His company, Ascension RS, has developed dozens of drug and alcohol inpatient treatment centers, outpatient programs, and sober living homes. He works with WVU Medicine Center for Hope and Healing regularly. And thank you to Senator Capito for taking us to her home state. You can watch our extended interview with the senator on Full Court Press Overtime. That will be posted to our website, fullcourtgreta.com. You can also find our show and interviews on Roku, Amazon Fire, and our Full Court Press mobile app. And that's it for us. We will be back here next week covering the latest political news and analysis that impacts you. And happy 4th of July. Hope you get to enjoy the holiday weekend with your family and friends. See you next Sunday.